33.
This one we favored papillary eccrine adenoma.
Papillary eccrine adenoma, very good. And there's another entity that I think is very closely related, tubular apocrine adenoma. I think that there's a lot of overlap and that those two entities probably are very closely related. At least I have trouble distinguishing them. And as you can tell, if I have trouble distinguishing something, I just say, oh, they're closely related, rather than admit that I'm just not good at telling them apart. So that's the way I deal with that. Okay, the key to these is that they have lots of tubules, but the tubules are, instead of filled with keratin, like in that trichoadenoma, they're filled with secretion. Dried up kind of thick sweat secretion. They have a double layer of cuboidal lining, like sweat glands do. And then some of them will have little proliferating tufts or papillae or micropapillae of cells pushing into the lumen, okay? And in the middle, they can look very infiltrative, right? It looks very busy, but if you look again from low power, the actual outside of the lesion is relatively circumscribed. The one thing I would use caution is if you see stuff that looks like this and you're on the acral surface, always keep digital papillary adenocarcinoma in mind. I have seen these on acral skin, but I've made that diagnosis with great caution and trepidation, because it's easy to miss digital papillary adenocarcinoma if you're not familiar with it, because it doesn't usually look cytologically atypical or malignant, and they can behave in a malignant fashion and cause big problems. So this is a good one to know, but if you can't see the whole lesion, it's one where I might want a complete excision just so I can see the periphery of the lesion and assess and make sure it's circumscribed. So papillary eccrine adenoma.